Welcome back to Speak Your Mind on Gold FM, only the classic hits. And we have been discussing about, the leading cancer in men in the world and in Fiji. We've been discussing it with our friend here, that is Dr. Rajiv Patel from CWM. Now, we just pick up off where we left. You know how you said you had those different tests that you did with those, last check-ins that you had done with the Golden Oldies Club, right? So, why do you think men don't really want to get this test, like a lot more men, because they feel embarrassed, or what do you think it is?
The first thing is that they feel embarrassed, The reason is that they think about the test. The test involves a digital rectal examination and a blood test. And most men are embarrassed with the digital rectal examination. So, I would recommend that, that if that's the one problem, is the embarrassment. Second one is that there is not awareness. They do not know that could be tested, for prostate cancer. Now, I would suggest that if you are embarrassed about the first part, then you can always come and do the blood test. And depending on what are the results on the blood test, and then we can further talk, and see what's the next step.
Okay.
Because the blood test itself does not equals to cancer. It suggests that it may be cancer, but you need to do a confirmatory test. It's a biopsy done.
Right.
Now that will confirm whether. So that's like a stage in process. So we call our patients together. We discuss the pros and cons of all the tests, and once they have the test done or the results comes out, then we again discuss with them. The next step is the biopsies,
I see. So, it is a very sensitive, I must believe, for men. They're masculine and they wouldn't want to be put through something like that. And I suppose your approach, as well as everyone in the Ministry of Health, you have to have the right approach to make them feel comfortable, I suppose.
Yes.
Yeah, so you have training on this? Or?
Oh, yeah, no. So all the surgeons and all the doctors that have gone through the medical school training, they know all about this. And anyone, if you go down to any health center or any GPs, they will do these tests. And then depending if there's any abnormality, they'll refer to us to the urology clinic, and then we can then further discuss them.
Yeah.
And rest be assured that the sensitivity is taken care of.
Oh, that's great. So what would you like to tell the listener to encourage them to get these tests done?
No, I would like, look, if you're above 50 and if you have bothersome passing urine difficulty and all that, just head down to your nearest GP or your doctors in the health centers or in the hospitals and get this, and tell them that you want to have your prostate cancer, checked and all that, and they'll do a blood test and all that stuff, and then they'll refer to us to the urology clinic. Okay,
so you're saying that you can even get this done at any health center around the country?
Yes, you can get it done at any health center, but like I said, the downtime, it's because at the health centers they do not have the reagents. They have the reagents at the hospitals, and what they do is they usually test in batches. So they'll collect samples for about 2 weeks or something, and then they'll test the thing. So the downtime in the public system is that there's a longer waiting time compared to going to a GP or private lab.
I see. Now, I believe you recently presented a research on prostate cancer and men's health in urology in New Zealand. You might like to share with us what exactly it was that you did?
Yeah, no. So like I mentioned in the earlier part of the segment, was that there was 4 parts to the study. The first part was to look at the level of lower urinary tract symptoms. Now, as men grow old, the prostate sort of enlarges. That's normal physiology, like it sort of gets enlarged. What it does is that apart from getting it enlarged, it narrows the urine passage, and males have difficulty passing urine. So we're trying to assess that how bad it was. So in our survey of 500 male, we found out about almost 53% or half of them had difficulty passing urine, which was sort of bothersome to them, and it affected the quality of life. Now, it's quite high compared to the other studies across the world where the percentage was around about 20 to 30%. The reason it was being high for us is because we concentrated on these males, so that's why it's being high. Now, having said that, there is treatment available for all of these. We can give you medications. If medications don't work, then we give you surgery.
Okay.
So that was one part of the study. The other part of the study was to look at the levels of erectile dysfunction. Now, of the 500 males that we saw, there was about 80% of them had some form of erectile dysfunction. So you could just say like a quarter of them just had normal function. Now this was attributed because a large number of our population had diabetes.
I see.
Now, if you have diabetes, your risk factor for getting erectile dysfunction is also high.
Okay.
Now, what I'm saying is that in Fiji, the prevalence of diabetes is high.
Mm-hmm.
Back in 2002, when the WHO did a step survey, they found out that there was about 16% the rate of diabetes among the adult population. That's like 1 in 5 adults. Now, unpublished data from the step survey done last year puts it around about 30%.
Mm-hmm.
Now, that's like 1 in 3. So if you go down in town, every third adult you see is either going to have diabetes or it's likely to going to have diabetes. See, so then you can see that if a third of the population has diabetes, then the complications from diabetes is going to be high.
So it's going to affect that part of the man.
Yeah.
They can't really nicely.
More like an
probably.
erectile function is poor.
Oh, I see.
There's difficulty getting any erection and all that stuff.
Okay, so that's because
and
of diabetes.
Yeah, and that affects the psychological and the social life.
Oh, I see. So, I mean, when you think about it, diabetes is a non-communicable disease. So, I mean, you don't really have to get diabetes, well, unless you have it, obviously, in the family, in the genes. So...
well, if we digress just from diabetes it's more of a lifestyle disease.
Yeah.
And more commonly, it's due to lack of exercise and your diet.
Exactly.
And what we need, I'm encouraging people or the males to do is to exercise more, eat your diet properly. I mean, choose foods wisely, you know.
Mm-hmm.
And there's lots of Ministry of Health has published a new book, Kana, and that shows different varieties of ways of cooking healthy foods, you know. And so what I would recommend is that still in Fiji, the number one cause of death is not prostate cancer, but it's the NCDs.
Okay.
It's the diabetes and the hypertension and the heart attacks that's going to kill you.
Mm-hmm.
Now, if you take care of that, automatically you will control the other parts of your body and your systems.
All right.
Right?
Yep.
So that was the second part of that study. The third part of the study was to look at how knowledgeable were our males with regards to prostate cancer.
Mm-hmm.
Now, 2/3 of our population, or the male population, have no idea where the prostate is.
Wow.
They have no idea of the symptoms of prostate cancer. They have no idea of where the symptoms are. I mean, what are the tests used for prostate cancer? They have also have poor practices. So what I mean by practices is that of 80% of the males sampled had no idea that they could be tested for prostate cancer.
Okay. Well, I'm sorry to just cut in there. We need to head into another short break on Speak Your Mind right here on your only classic hits radio station, Gold FM. Only the classic hits. We'll be right back. Bula Vinaka, and a warm welcome once again to this week's episode of Speak Your Mind. And this is Louise County-Seller, your host for this week. And, we have a very interesting topic this week. And you do know that prostate cancer is the leading cancer for men in the world as well as in Fiji. And in a recent study conducted by the Ministry of Health, it had been known that, it was called the Fiji Health Study, and it has been found that a lot more awareness is just needed to address this disease. Now, why? Well, simply, a lot of people don't know exactly what prostate cancer is to start with. Now, our guest in the studio today is Dr. Rajiv. He is from the CWM. Dr. Rajiv Patel, who is here to share with us his knowledge of this silent killer. Now, thanks for joining us, Dr. Patel, and a very warm welcome to you.
Thank you.
Thank you. Now, Well, we'll just start off with a quick introduction from you before we start. Mr. Patel, where did you grow up?
Yeah, no, I was born in Lautoka, did my school, primary school, secondary school in Lautoka, and then did my medical training in Fiji. I'm currently doing my master's in surgical training, my final year, and hope to graduate this year, and then do another specialization in urology.
Okay, so when was it when you thought that you wanted to enter into the medical field? Was it earlier on in your life?
Yeah, just yeah, probably early years in my life. Yeah, probably when I was primary school. So
Okay, great. So anyhow, so what is your area of expertise in the medical field?
I usually do end up. I'm in general surgery, so I look at people with surgical problems, and so we're just doing that at the moment, and doing a bit more of urology work, looking at kidneys and bladder problems in both males and females, and yeah, so that's the thing at the moment.
Okay, now could you please tell us what prostate cancer is?
All right, prostate cancer. First, we should know what prostate is. Prostate is located in the male side, found in the males only, and is found below the bladder. The aim of the prostate is to produce a substance that sort of liquefies the sperm, and that sort of the function of the prostate is. Now, what prostate cancer is that cells usually normally die and regenerate. It's programmed, but once that program is sort of distorted or broken away, then you have this uncontrolled growth of cells, and that is known as cancer. So that's what is called prostate cancer. It's just of uncontrolled cell growth in the prostate.
Okay, so what are the symptoms of prostate cancer, doctor?
Now, prostate cancer comes, it's just not just like a uniform disease. It comes in stages, depending on what stage you get of cancer is, whether it's stage 1, which is early stage, and stage 4 being metastatic, means which is spread out. Stage 1 and 2 disease, like you'll have just difficulty passing urine, you'll have blood in your urine, you may have some back pain, But when it goes to advanced disease like stage 4, then you have problems with breathing, you have severe back pain, you have paralysis kind of thing.
This is awful. I mean, that should be a leading factor for men to actually get the test done earlier on.
They should. We recommend people to have their the prostate cancer being tested early, and usually there are 2 ways we can do that. One is using a blood test known as a prostate-specific antigen, or PSA, and the other one is a digital rectal examination, which involves putting up a finger up your toilet passage and then filling the prostate. Now, the second one, the DRE, which people are not very comfortable with, so we understand that. So we have offered them that there is another substitute called as a PSA, which is a small needle prick into your arm. We get out about 3 mils of blood and we send it for testing. And depending on whether it's abnormal or normal, and then we can discuss further with the patients.
I see. So how long does it take before the results are known when after doing the test?
Now, if you come in the government system, due to limited resources, the results come in batches kind of thing, in the sense that it may take a downtime of about 2 weeks to a month. But if you do it in a private facility, the downtime is just a 1 day. So you have your test done today, results tomorrow.
Okay, so about the Suva Golden Oldies Rugby Club, I think they're doing a fantastic job of raising awareness on prostate cancer.
Yes, Suva Golden Oldies Club, these are a group of old men that have come on board, and these guys are really pushing men's health, the agenda of men's health in Fiji. Now, they have come on board from last year, and they've given a sponsorship about 15 grand to conduct Fiji men's health study, which was done about 2 months ago, where we surveyed about 516 males in Suva, Lambasa, and Lautoka, and we'll talk about the results later. But they are being sort of one of the 4 main NGOs out in the field at the moment that are promoting men's health.
Yes, I think they're doing a great job.
Yeah.
Yeah. So, Dr. Patel, what do you think are some of the main reasons that lead to a person getting prostate cancer?
Now, some of the main reasons are, first thing is that if you're a male, you're at risk of getting prostate cancer. Second one is your age. Now, as we get older, the chances of getting cancer, not just in prostate, but any other cancer, increases. Now, in males specifically, in regards to prostate cancer, as you grow up as you pass 50, it significantly increases. So your risk probably around about 20% to 30% risk. Now, in generally speaking, like men in the Pacific, the risk is that 1 in 8 males you see are more at risk of getting prostate cancer. In Australia, they say it's 1 in 5. If you reach 85, 1 in 5 males would get it. So the longer you live, the more likelihood you'll get cancer. Now that's one risk. The other one is the other one that has been noticed is your positive family history. If somebody in your family has got prostate cancer, you're more likely to also get cancer. The third risk factor is your diet. They have noticed that if you have a higher protein and a high fat diet, you're more likely to get prostate cancer. The fourth factor could be ethnicity. Now, it has been found that people in the African, North Americans and the Black Americans, they're more likely to get prostate cancer compared to the white population.
I see. Now, what is the key, do you think, to fighting prostate cancer?
I mean, the key is that in the last 20, 30 years, sort of men's health has taken a back step. The agenda has been usually on women's health and child's health, and that's perfect. That they should be looked after, but sort of the men's health has taken a back seat kind of thing. And the back seat means that there's not much awareness with regards to prostate or prostate cancer or men's health in general. So what has been the leading factor in our country specifically is that the awareness is really, really low.
I see.
So we just need to create more awareness.
Okay.
And once we get more awareness, then people will be more aware of the disease and they will come for testing.
Okay. Now, you did mention about, the Golden Oldies Club. You said about 500 plus tests you had carried out. Is this a good number?
Yeah, I mean, there has never been a study on men's health in Fiji. This is the first one that has been a baseline, you could say, that has been done. And what we did was, there's 4 parts of that study that we did was, one was to look at the levels of lower urinary tract symptoms. As men grow old, they have difficulty passing urine, so we just wanted to know how bad it is. Second was to look at the levels of erectile dysfunction. And the third one was to look at the knowledge, attitude, and practices with regards to prostate cancer. And the fourth one was just to see how bad the prostate cancer is. And that was done using the PSA testing and the DREs.
Okay, well, we'll be back for more. We head into a short break here on Speak Your Mind on Gold FM, only the classic hits. Do stay listening for more. Welcome back to Speak Your Mind on Gold FM, only the classic hits. This is live on radio, so you are most welcome to call if you'd like, 3220-907, if you have any questions at all for Dr. Rajiv Patel, 3220-907. Remember, this is a replay on FBC TV every Tuesday night at 10:30, as well as the following morning at 10. Now we pick up once again from where we left Dr. Rajiv, and the third and fourth part of the study that you were talking about before we went into the break.
Yes, so the third part of the study, like I mentioned, was the assessing the knowledge, attitude, and practices with regards to men's prostate cancer. I mentioned earlier that only two-thirds of the population had male population sample had no idea of the prostate, and the tests are available. Also, with regards to the attitudes, the health-seeking behavior and the perception of getting prostate cancer was quite poor. So this was almost two-thirds of them had poor attitudes. The third part of that thing was that we had to look at was the practices. Now, of that, only 10% of the population sample that had only had the prostate cancer checked in the last 2 years. So people had no idea that they could be tested for and that. Now, the fourth part was to check the incidence or the rates of prostate cancer in the Fijian population. So our crude rate came out to about 77 per 100,000. Now, there was another study done by Foliaki almost 2 years ago, and he put his study around about 10 per 100,000. And ours is like about 77 when we conducted this study about 2 months ago. And the reason it's been quite high is just because we targeted the male population in our settings.
Okay.
And that's why we have a high pickup rate here. Now, these are the people who had come for the screening for the study, but there are other males out there who are undiagnosed at the moment and who now have no idea that it can be tested. So we're hoping that through this medium and through the promotion of this month, November, we will be able to create more awareness.
Okay.
Now, when I mean by creating more awareness, what I mean is that not just the male population, but we expect to create awareness right across the board, even the females. We are trying to teach females also about prostate, so that they can look after their families, their
Yes.
husbands and their spouses, their fathers and their uncles, so that they can also be involved in the decision-making process.
Exactly. So how often would you recommend men getting tested for prostate cancer?
Now, if you are above 50 years of age, then we recommend that almost every 1 to 2 years to come and have a PSA, a blood test done. And then if it's normal, and then we can sit down every 3 to 5 years, then you can have your blood test taken.
Mm-hmm.
But if you have a positive family history, so we recommend you to come in early, around about 40 or 45, to come and have your PSA test. And then depending on that, then we will find out.
Okay, so no questions yet. 3220-907. You can ask Dr. Rajeev whatever is in the back of your mind. You are most welcome to call in for questions if you'd like. Now, Dr. Rajeev, what percentage of prostate cancer sufferers are ETA okay? Do you have the knowledge of maybe the percentage-wise for ETA okay and Fijians of Indian descent?
Yes, it was around about 30% kind of quite high among the indigenous population and also the Indians of Fijian descent, Fijians of Indian descent.
Mm-hmm.
Now, having said that, the stages at which they present are quite different. From the study itself, we found out that there was a higher grade among the ethnic group, the Itoke group. They presented with late stages or high-grade cancers, more aggressive forms of cancers.
I see.
Now, this is also backed up in a similar study done by the previous urologist, by Dr. Uzal in 1999, that he noted also that the Itoke population that was admitted in CWM hospital presented very late. They presented with stage 3, stage 4 disease, really sort of metastatic disease. And the reasons, I think, like I said, from the study concludes that there is lack of awareness with regards to prostate cancer.
Right.
And males traditionally, not just now, but from way back, they do not seek, the health-seeking behavior, the patterns are quite poor.
Okay.
So they would probably suffer silently and then they come, when it's problematic to them.
Too late.
Yeah.
And I mean, gosh, life is short already, and if you don't do these sorts of things.
Yeah, I mean, life is short, but the life expectancy from Fiji is increasing. It's almost 72 years. Previously, it was around in the 60s, and now and we expect that the health of this country, the life expectancy of both males and females, to increase. There is development happening, the health services are improving, so the life expectancy is going to also increase. With the increase in life expectancy, you'll have higher incidence of cancer right across the board.
So, like you said, I mean, it's like cancer affects every part of the body. So, you don't have to relate it only to prostate. I mean, for women as well, every part of your body gets cancer.
Yes, the women had the Pinktober last month where they create awareness for breast cancer, and the other cancer that they are more worried about is usually the cervical cancers,
Which is the leading cause of death in women in Fiji, is that right?
Yeah, it was initially, but now the breast cancer has come up more. So, yeah.
It's very sad, isn't it? I mean, gosh.
What I'm saying is that, look, there is facilities available in the hospitals for both. For cervical cancer, prostate cancer, breast cancer, which we can test early stages, And if we test them early stages, we can treat them.
Right.
But if you come in the later stages, stage 3, stage 4, the options are quite limited.
Yeah.
And there is no treatment. And the treatment is then focused on palliative care.
Right.
Just to improve the quality of life, That's what happens. If you come in early, we can cure you of your disease,
Exactly. So, I mean, that is obviously the stronger message, which is early detection, I would expect, yeah?
Yes.
Okay, so with the study in New Zealand, so you after that you went to Melbourne,
Yeah, Melbourne was for a different course.
totally different.
Yeah.
Okay, so we stick to prostate cancer. What would you like to see in the future for prostate cancer in Fiji?
Oh no! Look, the urology service has just started this year. I mean, really, like fully functional. We have a dedicated unit now in CWM Hospital.
Mm-hmm.
Dr. Surya is the head of the department, and what we have been doing in the last 3 years is that we have been going down to Lambasa, Lautoka, and here in Suva. So we go monthly visits to Lambasa and Lautoka and look at our urology patients there, and we find all our cases there. So the unit is there, and we are sort of flourishing now, and we're capturing more people there. Now the next step is to create more awareness with regards to men's health. So in the next few months, we'll be rolling out programs and awareness programs to create more awareness on prostate cancer and men's health.
That's great, Dr. Rajiv. Yeah. We'll come back shortly. We'll continue with what Dr. Rajiv has been sharing with us of his knowledge on prostate cancer on Gold FM, only the classic hits. We'll be right back soon. Welcome back once again to Speak Your Mind on Gold FM, only the classic hits. Now, Dr. Rajiv, could you tell us, after a person has been diagnosed with prostate cancer, what sorts of treatments do you give?
Now, once someone has been diagnosed with prostate cancer, the next step is to stage the disease, and that involves doing your blood tests, your chest x-rays, and your CT scans, which are all available here. But the treatment options are only available in Fiji at the moment is surgery, and that's like radical prostate. So we remove the whole prostate and then reconstruct the urine passage again. Mm-hmm. The other options are for radiotherapy, and there are several forms of radiotherapy that they offer. Now we don't offer radiotherapy in Fiji, but if it's like an early stage disease, what we do is we recommend treatment overseas to either Australia or India. And the ministry bears some parts of the cost with that. So, So with regards to the treatment, those are the options. So we only offer radical surgeries here. Mm-hmm. But if you go down, but there are other options available in Australia and New Zealand where you can do it laparoscopically or robotically.
Wow, robotically.
Yeah.
That's for real. Yeah, you got robots who do surgery as well.
Yeah, so it involves it's like sitting down in front of a computer console, and then they have probes into the abdomen, and then the surgeon sort of remotely operates that apparatus. There are a couple in Australia and New Zealand at the moment.
Okay, so when you talk treatment, like what you've mentioned, would that be the advanced stages of treatment or the early stages of treatment?
So like, if it's in the early stages of the disease, then what we can do is offer them cure, and that involves doing surgery plus radiotherapy.
Okay.
No, but if it's like an advanced disease, then since the disease has been spread, the effectiveness of surgery is quite limited, because the whole aim of the surgery is to remove the whole disease process or the organ, which is the prostate, plus some of the normal surrounding tissues. Now, in the advanced stage, it's quite difficult because it's spread to the surrounding organs. So what we offer them is palliative care, and that involves sort of removing the testes. Now, the reason why we remove the testes is because the testosterone, which comes from the testes, sort of stimulates the prostate growth. Okay. So we're just trying to remove the source. Okay. Now, how do we remove the source? We can remove it by chemicals or by surgically. Chemical means giving some chemotherapy drugs to stop the production of the testosterone, or we remove the testes.
Oh dear, it's really sad, I must say. I mean, my goodness me. Okay, so that's very important. Early detection, as doctor has said. So get your tests done, as you've mentioned. The age is already, and so this treatment. Okay, about palliative care. Do we have a proper place to be able to care for these people who are in the last stages?
Well, no, we don't have like a hospice around to treat people with these terminal ill conditions. It's usually the family support that offers the palliative care.
Mm-hmm.
But we do have, like, sometimes they get really sick, like for example they vomit a lot or they get anemic, then we give them some blood, or if they have some severe pain then we give them some morphine tablets or some painkillers to control the symptoms.
Mm-hmm.
So in palliation it's just more like controlling the symptoms and just to maintain a good quality of life.
Exactly.
But
Keep the patient as comfortable as
Yes.
possible towards the end, the last
Yes.
stages, I suppose. Yeah.
Yes, but like in Australia, New Zealand, you have a dedicated hospice around that sort of controls and it looks after these people.
Yeah.
We do not have that facility here at the moment.
Okay. So, do you think that you'd like to see us have something like that for cancer patients?
Yeah, I mean, the population of Fiji is increasing, the life expectancy is increasing, the incidence of cancer right across the board will be also increasing,
Mm-hmm.
and people will come either in early stages or late stages. Yes, we do need someone to look at the end stages. Yeah. Now that's a discussion for the Ministry of Health and the other stakeholders.
Mm-hmm.
But having said that, we have good support organizations there, like the Fiji Cancer Society, that sort of helps people, with this sort of conditions.
Yes. Really
So-
important, I think. I think it's something that we should have, but of course, it's going to cost a lot of money, I suppose, to get something like this. Yeah.
Yeah, no, this is going to cost a lot of money. There's no doubt about it. But we're creating awareness, and there's a lot of pledges and a lot of funds coming from the corporate bodies. They're part of the social responsibilities. They're giving us a lot of money out for these causes.
Mm-hmm.
So we should have something in the near future.
Yeah, that'll be something I reckon that I would like to see for cancer sufferers, because you lose your dignity when you have this illness. It's really sad. So much pain. Yeah.
Yes.
So you guys give morphine and all that for the last stages.
Yeah.
Oh dear. Okay, so anything else that you'd like to highlight?
Yeah, no, just like to mention the Silver Golden Oldies Club. They have been one of the proactive organizations or the NGOs in the last few years that have championing men's health. And then I think November 29th, they'll be having a Balls and Beards game, I think at the Cathedral grounds, and they'll be trying to launch more on men's health. And I think the Minister for Health, Mr. Sumate, is going to be the chief guest. And so that's where we'll be trying to raise more awareness with regards to prostate cancer.
Okay, so what is exactly going to be done? They all give money and take part in the game or something, a game of rugby, or what is it?
Yeah, so there's going to be a game of rugby happening there. I think there's going to be some tests, blood tests, PSA may be happening, and also a couple of guys will be shaving off their beards and their dreadlocks. So yeah.
Oh, that's really nice. So on the 29th, everyone's invited?
Yes, just watch the media space. They should be out, advertisements out in the next few days.
Uh-huh. All right, then we'll be back for more when we return on Gold FM, only the classic hits. This is... Welcome back once again to Speak Your Mind on Gold FM, only the classic hits. And we continue with our discussion here with Dr. Rajiv, and I certainly hope you found it interesting. So, Dr. Rajiv, what is your advice to the males in Fiji?
What I would tell not only the males but to the whole population, especially the females, and also that, look, prostate cancer is a deadly disease. And it can be tested, and that couple of ways it can be tested. Like I mentioned, was a blood test or a digital rectal examination. And I would recommend that if you are worried about that, you should just go down to your nearest doctor and to learn about what prostate cancer and get tested about it. And why I'm encouraging the females is because they're also important part of the decision making processes. That they should be aware of what their spouses or their partners or the dads or the uncles are going through. Now, the other thing that I would like to mention is that maintaining an active and healthy lifestyle. That is really, really important. That's the crux because more people will not die from prostate cancer itself, but they will die from the cardiovascular or the diabetic complications. And the way we can prevent that is to the first to prevent from getting the disease, and it's eating healthy and exercising. I would recommend that you take exercise every day for about 30 minutes. Do whatever you can, either walk in the gardens or go for a walk on the streets, but lead an active lifestyle. Control your diet, your sugar intake, your fat intake, and those are the two main things that I would like, that you should lead an active lifestyle. Now, if you already have diabetes or high blood pressure or cardiovascular disease, you need to have your checkups done regularly, take your medications on time, and those are the two main things that I would recommend.
All right then. So, Dr. Rajiv, how do you think that we could change the attitudes of males in Fiji? I know you've mentioned awareness and also, family getting involved.
Yeah. So in the next few months, the ministry is going to be, in conjunction with the Golden Oldies and the Urology Center, will be rolling out programs out. We'll also be going out to schools and talking to them, telling them what functions of prostate, what are the signs and symptoms of prostate cancer. So it's going to be a multifold, and then we'll have pamphlets coming out and all that stuff, TV ads and all that. So the whole works are out there, going to be to improve, create awareness on men's health.
Okay, so I believe you're a very busy man, because you've got lots of work to do and to be dealing with this very sensitive illness, prostate cancer. And I know we just thank you so much for you getting involved and just raising awareness right now on Speak Your Mind is great. And I'm sure that you will convince many men out there to do the right thing.
Thank you. I'd just like to thank FBC for getting us on board here. It's the shows like this that create awareness. And so most people in this country have access to the television or radio, and this is one of the ways we can create more awareness. And I'd like to thank the FBC for taking an initiative in not in just men's health but in women's health last month with the Pinktober functions that was happening.
That's absolutely right. Well, we thank you so much for your time, Dr. Rajiv. Until next time, you have a lovely afternoon.
Thank you, madam.
Naka. Speak Your Mind.